Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Pemphigus vulgaris. Pemphigus vulgaris is a rare chronic autoimmune disease that affects the skin and mucous membrane. Pemphigus is a blistering disorder caused by autoantibodies that result in the dissolution of intercellular attachment within the epidermis and mucosal epithelium. So it does not involve the dermis. It is the problem of the epidermis, and it is the epidermis, also the suprabasal layer of the epidermis. Epidermis has multiple layers. One is the deepest layer, the basal layer. In Pemphigus vulgaris, the suprabasal layers are affected. The pathophysiology of blistering disorders provide important insights into the molecular underpinnings of the keratinocyte adhesions. These are the suprabasal layer of the stratified squamous epithelium. What is the etiology? What is the cause of Pemphigus vulgaris? This is an autoimmune disease, so autoantibodies attack desmoglein 1 and desmoglein 3, proteins essential for keeping skin cell bound together. Skin cell means the keratinocyte, like that of the suprabasal layers of the stratified squamous epithelium, like stratum spinosum, stratum granulosusum, layers of the epidermis. In Pemphigus vulgaris, the immune system mistakenly attacks protein called desmoglins, that is the desmoglin 1 and desmoglin 3, which are crucial for cell-to-cell adhesion in the skin and mucous membrane, the epidermis of the skin and mucous membrane. As a result, this leads to formation of painful blisters and erosions. We have also another para on drug-induced Pemphigus vulgaris. So, what is drug-induced Pemphigus vulgaris? What is that? This can happen when certain medication, particularly thiol-containing drugs like penicillamine and captopril, trigger an autoimmune response leading to the characteristic blistering and erosions of pemphigus. Okay, this is the medication penicillamine and captopril, or the drugs related to them. Okay, so we may have oral lesion, the mucous membrane like this, and also this is the obviously over the skin at the back, and also happen in the anterior aspect of the body. This may be aggravated by certain drug. Okay, so this is the Pemphigus vulgaris. Blister will be broken and the skin, the epidermis will be the basal, suprabasal layer of the epidermis will be exposed and damaged in the Pemphigus vulgaris. So eroded plaques are formed following the rupture of confluent thin-roofed bulla. This is this. Suprabasal acantholysis result in intraepidermal blister in which discohesive epidermal cell or acantholytic condition, there is a discohesive epidermal cells are present here. Ulcerated blisters in the oral mucosa are also common, as seen here on the lip here. Okay, what happened? This has been taken from Robin Scott Pathologic Basis of Disease. Here is the fluorescence test. What happened in fluorescence test? In Pemphigus vulgaris, there is deposition of immunoglobulin along the plasma membrane of the keratinocyte. These are the epithelial cell layers on the epidermis in a reticular or fishnet-like pattern accompanied by suprabasilar loss of cell-to-cell adhesion, like this. Cell-to-cell adhesion is lost. In acantholysis, selectively involves the cell immediately above the basal layer, producing a suprabasal blister. The majority of the individuals who develop pemphigus are in the 4th to 6th decades of life. So 40 to 60 years. Men, women are affected equally. So it is a disease of the adult person between the age of 40 and 60. Variable superficial dermal infiltration by lymphocyte, macrophages, and eosinophil accompanies each type of pemphigus. Involves the mucosa and skin on the scalp, face, axilla, groin, trunk, points of pressure. It may present as oral ulcer that may persist for months before skin involvement appears. Key features: blisters and erosion typically occurs on the skin and inside the mouth, but they can also affect other mucous membrane like throat, nose, eyes, and genitals. Okay. Fragile blisters. The blisters are usually flaccid, easily ruptured, and can leave raw, painful areas. Positive Nikulsky sign. Gentle pressure on the unaffected skin can cause the top layer to slide away from the lower layer, indicating a lack of cell cohesion. Okay, how can you diagnose this disease? Diagnosis of Pemphigus vulgaris. Clinical examination, identification of characteristic blister and erosion. Skin biopsy to examine the pattern of blistering. Direct immunofluorescence, detect antibodies bound to the skin cells. Blood test to identify circulating autoantibodies. So we'll do physical examination, we'll look at the blisters, we'll look at the mouth cavity, other mucous membrane, throat. Okay. So we'll then also do the Nikulsky test, skin biopsy, direct immunofluorescence study will see antibodies bound to the skin like fishnet-like appearance as we have seen previously. Blood test to identify circulating autoantibodies. Treatment and prognosis. As because it is an autoimmune disease, so we need to give corticosteroid to reduce inflammation and suppress the immune system. Immunosuppressive agents such as azathioprine or mycophenolate mofetil. Biologic therapies, rituximab is commonly used for more severe cases. Wound care to manage blistered and eroded areas. Antibiotics and antifungal to treat secondary infection. Okay, antibiotic for the bacteria, antifungal for the fungi. If the fungus is also present there or developed. Prognosis with modern treatment, the prognosis has proved significantly, but it often requires long-term immunosuppressive therapy. Early diagnosis and treatment are crucial to minimizing complication. That's all about Pemphigus vulgaris. It is a serious disease where blister and it may be fatal if it is not treated because of infection, because skin is eroded in many places. There will be ulcer inside the mouth. And that's all about Pemphigus vulgaris. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.